Natalia Aramasho. Natalia was asking for changing the schedule because she's in trouble with her schedules at the university. So that's why I decided to help her and then come earlier. So let's wait a little bit and I hope she can get into the workshop in the schedule we agreed, because I don't have any other time. While we expect, well, let's close the microphone and then I'll be back in a few minutes. Well, until this point, Natalia didn't stand. I think she got in confusion with the schedule, so I'm gonna expect for her later, I think. Let's have patience. So I'll be back in 2 minutes with the next student. Well, at this point, I'm expecting Gabriela Greda. She's not attending yet, so let's wait a little minute more. I'll be back. Hi, Fernanda. How are you? Hi, Fernanda. Can you listen to me? Yoo-hoo. Hi, Fernanda. I cannot listen to you.
Hi, Doc.
Yes, perfect. Now I can. How are you? How was
Hi,
your
Doc.
day?
Everything okay, Doc?
Perfect. Dear, did you prepare the exercise too? Did you have enough time to write it down?
Yes, Doc.
Perfect. Let me give you the chance to share the screen.
Okay.
Well, send me by WhatsApp and then let's share on the screen, okay?
Okay, Doc.
Okay, now I think you can do it. It's fixed.
Mm, Doc, I can send you all the homework now.
Yes, that's okay. It's better if you send me the homework too. I will have time to check it or to make the score do, and there's no trouble. Okay. Perfect. I got it. I'm downloading the files, and please, in order I'm downloading. I think you can share the screen now. Okay.
Okay.
Okay, can you share the screen? Is that okay for you?
I can, Doc.
Okay, let me check it again. Okay, now can you do it now?
Mm,
Okay, you're going to be a co-host, so maybe now you can do it.
no, Doc. I made handwrite and some.
Okay, it's not possible because of that.
Yes.
Okay, no, don't worry. Okay, so let me share the screen. It was downloading, but don't worry. Give me a second, please. Well, the idea of this exercise is to get this part prepared.
Doc?
Yes, I was telling you that the idea about this exercise to report the pictures, the images, and get everything on the lab tests and everything, it was to prepare the basis of the letter of referral. It might be easier to write it down if you get it clear and if you get it ready. Can you watch my screen?
Yes, Doc.
Perfect. So I'm sorry, let's start reading this. Examination, spot formulas. Okay, you corrected it, perfect. On her complementary studies, the biochemistry hematology results are normal. Perfect. The ultrasound showed a mammary tumor. Just a mammary tumor? Well, if that's the sound, the ultrasound, it's perfect. I'm sorry.
There. I want to write biopsy.
Okay, the biopsy.
Yeah.
Okay, I'm gonna send you by the chat how to write biopsy, okay?
Okay, Doc.
Okay, it's done. There's a tumor. The magnetic was necessary for the diagnosis. Okay. Okay. That's good. You are giving me the headline, the next step of your treatment, and that's a good point. Okay, let me share the screen again, showing you the letter of referral. It's important, this slide, because from this basis we can work on the letter of referral. Do you remember we had this exercise?
Yes, Doc.
Well, here we have some options, I can say, talking about how to write down this paper, and some details that are important to take into consideration. For example, expressions and details while talking to doctors, in order to be polite, as much polite as we can, and of course get a good response about it. So one of the most important parts of the letter of referral is how you introduce you to your specialist, supervisor, I don't know, someone. This expression, dear doctor, is one of the most important parts. Why? Because you can ask for help, being confident on the capabilities of the specialist you are taking in account. If you say in Spanish, dear doctor, it's not well seen, it's not well considered, at least in medicine, because they think that you are losing the respect. That's the idea of the way they think. And of course, it's not correct, but they have this wrong interpretation. In English, it's not the same. In English, it's better if you start with this kind of expression. About beds, is that okay if you use this expression in Spanish too? Or maybe it's a trouble like in medicine?
It's a trouble.
Yes. It's similar for every career, I think. But in English, you have to be polite. It's considered a very, very, very polite expression in order to work on this and then get a correct idea. When you start, well, you can add, or you can start the full referral with this second expression. I would be grateful if you see this and then you introduce your case, your patient, right? I would be grateful. It's not common in Spanish, I think. It's like to say, make me a favor, a personal favor, but it's not the same in English. In English is the best way to start it because it's a polite way of introduction about the patient. So we have to catch the difference and then understand that it's possible to work on this way. In this other language, especially in England, you can use this. In USA, depending on the situation, you can use the same expressions. But in general, it's a very good way to start the referral.
Okay.
As soon as you get these two expressions, you start with your case. For example, with you, a 12 years old female dog, or yes, female dog presented into the hospital, and then all the explanation. So taking this information that is a resume, it's better if you make a briefer resume and one resume, a new resume from this paragraph, I mean.
Okay.
Okay, I think it could be nice. For example, you start with this, with all the principle, the complaint, the main idea, and then you start with important details in the physical exam that are, or details in the patient's speech, taking into account the most interesting signs or symptoms that they are following, that they are finding.
Okay.
As you finish this, you start supporting your medical thoughts. At the beginning, you say this in this way. Here, his symptoms suggested, and then you start with the diagnosis. You give the diagnosis at the beginning of the second paragraph, not at the end of the referral. You give the diagnosis, and then you can express, you can support the diagnosis describing all the studies, lab reports, I don't know, CT scan, MRI, ultrasound, everything you have supporting the diagnosis. In this example, this was confirmed by examination, we revealed the physical exam, and then the lab reports. That's why I was asking for these details. You support your findings, you support your labs, you support your images, and then when you finish all of this, just say goodbye in a polite way. Expecting you have a great day, for example, or trusting in all of your help with the patient. Thanks for your assistance. And that's all, something like that. Very kind expression for saying goodbye, and that's enough.
Okay.
So when you prepare this exercise, the first part, like you have now, it's easier to make the letter of referral, right? Because you have organized all the ideas. Just write down a brief resume, taking count the most important ideas, and that's enough. Is there any question until this point?
No.
Okay, it's kind of easy to make, right?
Yes.
So with you, I have 4 reports done in order to work on this part. And then tonight, I'm gonna send the topic points, the principal ideas about the letter of referral. And then you are going to write down in your case to whom you are going to send your patient.
Okay, Doc.
Just for getting in practice. Intubates, do you have specialties? I didn't ask you that.
Yes, Doc.
Well, too complicated.
Yes, some of the specialists. First,
and they are special too, I think.
the specialist in an animal, and then there are oncologists, dermatologists.
Oh my God, too much information. Yeah. No, it's so hard. Okay, perfect. So let me prepare the file and then we can work on this, okay?
Okay, Doc.
So, see you Monday, dear. Have a nice weekend. I'm gonna send homework tomorrow night. New quizzes and assignments.
Thank you, Doc.
Okay,
See you
thanks for
Monday.
your attendance. Bye.
Bye, Doc.
Hi, Angelica. How are
Hi,
you?
Doc. Good, and
How
you?
was your day?
Fine.
Okay, you look so serious, but that's okay.
Yeah, the
Don't worry.
university take problems.
No, it usually happens. Don't worry. Well, Angelica, did you work on the second part of the case report?
Yes, I work a little bit, but not in
Perfect.
the complete. I can
Okay,
share.
sounds good. Okay, did you make it into your computer to let you share?
Yes.
Okay, please share the screen.
Okay.
And then we can finish this and start working with the next step.
Okay. Okay.
I can watch it, ya. Está compartiendo, ya.
Now
Okay.
is watching or
Yes, I can watch.
okay. Well, this is the first part that I can make, and the writer report. I don't know how to start.
No, don't worry. Do your best.
Yes.
Tell me what you find here.
Okay. Well, I see this um
Don't
it's a
worry. I'm not evaluating the medical knowledge. Just expressions.
okay. This is a supine AP radiography of the abdomen and shows radiopathic fluid levels with dilated large bowel lobes.
Okay. Which quadrant is this?
In the left iliac
It's not
artery
left.
and left. Yes, right. The other one, yes.
Okay. The right quadrant, the low right quadrant, yes?
Yes.
Okay, perfect. You can say this is an abdominal X-rays. No, supine, it's not correct because when you talk about the supine position, the patient lie down, right?
It's like, yes, and you can see the levels. Okay, see, yes, upright, yes.
Yes, the upright abdomen X-rays showing radiopac fluid levels within dilated, and that's okay. But that's okay. Just correct the detail, and that's enough.
Okay. The area is first, or
Yes.
okay.
The position, area, the kind of X-rays, and that's all.
Okay.
The position, upright, abdominal X-rays or right quadrant, lower right quadrant X-rays of the abdomen, or abdominal X-rays. ¿Cómo se llama? Let me write down. I'm getting in confusion. It usually happens. All right. Abdomen. X-rays showing. Okay, upright abdominal X-rays showing in the lower right quadrant, and then the findings.
Okay. Okay. Right. Abdomen. Inferior quadrant.
Lower.
Lower, yes.
Yes. Low right quadrant, and that's. Try to use the abbreviations we were practicing because you need it.
Okay.
In order to practice bands. Don't worry.
Okay. And the report, well, I conclude that this is an abdominal obstruction.
Yeah.
For the lab's results, is the eosinophils is high, the white cells count is high. So
Okay.
this infection.
Just the most important ones. When
Okay.
you write down the lab report, you don't have to mention anything about the clinical findings. Just read the labs. In this case, you have elevated white cell count. And that's enough. The rest could be considered normal because they are values that are, at this point, not significant and are unremarkable.
Okay.
Because
Okay.
they are not so high. What is important? The hematocrit and the platelet count? No, the hematocrit just. Hematocrit is low, and that's all. Just the positive findings. When you have this, your patient is getting in complications, so don't worry.
Okay. So the right report started with the symptoms.
No,
No?
you don't need any symptom.
Okay. So I only write the most important.
Yes, just the positive numbers, the positive values, the most important ones. In this case, what's a white cell count? And then the hematocrit. That's all.
Okay.
We don't need more. The rest, the differential with the white cell counts, in my opinion, is not the principal point of view because these values are not, well, are unremarkable at this point. So they are not going to be a trouble when you get this patient into the surgical room.
Okay.
You operate the patient, and 6 hours later, they are going to be normal. Just in general, the count, the WC, are going to be in change. The rest, nah, no pasa nada.
Okay.
Don't worry. Yeah.
Okay. So
Yes.
in the right report, just only the more significant points, and that's all.
Yep. Yep.
Okay.
Can you correct it now? Is that possible?
I think yes.
Yeah, if you can do it now, let's do it. Let's do it. Please give me a second, please, while you write down, okay?
Okay.
Yeah, Angelica, do you remember the abbreviations about what's why it's cell count? WCC.
WC.
Yes, WCC. Try to use it while writing down, because you're going to get the opportunity to write completely. Yeah, but not now.
Okay.
Try to practice on this. I'm going to evaluate the use of abbreviations because it's important to get used of them.
Okay. Okay. I have to put the number of the results.
No.
Okay.
When you make a lab report, even in Spanish, depending on the situation, you can write down the value. If you have the necessity of that, I mean.
Okay.
For example, if you don't really need to write down the value, don't do that. Because you don't have to repeat information. You don't have to be rounding with this kind of writing that way.
Okay. So great. Let's see. Okay. So I think that is the lab result shows why associated and allow hematocrit.
That's all.
Okay, that's all.
Yep, no more. You don't need more details.
Okay, perfect.
So, in that order, please send me the file with the corrections, with all the details. Well, if you want to check again and then send it to me as soon as possible, okay?
Okay, okay.
And according to that, when I receive this, I'm gonna send you the topic ideas about the letter of referral. We can work on this on Thursday.
Okay.
Okay. Moreover, did you finish the quizzes and assignments?
Yes, I send you the assignments and the quizzes.
Yes, I received them. Thank you so much. I'm getting confusion, don't worry.
Okay.
Yeah. So that's perfect. In that order, let me send you the pool to take your attendance.
Okay.
And well done. Finish the corrections and we can work on this on Thursday, the letter of referral. We're going to write it down together, okay?
Okay.
And the file I'm gonna send you, we can correct it, well, we can check it. And if there's any questions, send me a message during the weekend, okay?
Okay, perfect.
Perfect, thank you for the poll. So see you Monday, dear. Good job.
See you Monday, Doc. Thank you. Have a good night.
Have a good night too. Hi, Natalie.
Hi, Doc. Good night.
Good night. How are you? How was your day?
It was fine, thanks. And yours?
Well, a very hard day, yeah. But it happens, yeah. Well, dear,
Yes.
did you finish the second part of this exercise?
I don't know how to explain the X-ray. I was trying to write something. I mean, the X-ray shows, I don't know if I have to say the appendix is radiolucent or how, because that part is black, so is radiolucent. So how can I say that? Said that.
Okay, the paragraph you write down, do you have it by handwriting or in your computer?
Handwriting.
Okay, send me a picture. Sharing this, you're going to understand it better.
Okay.
When you talk about anatomical details, I mean, you don't have to focus on the idea about game if it's radiolucent or radiopaque. You can do it. That's nice if it's a normal picture.
Yes. I'm writing down to WhatsApp to send you. because my handwriting is horrible.
No, don't worry, that's okay. My handwriting is awful and sometimes nobody understands this.
Okay, I'm finishing. The gas is radiopaque, right?
Yep.
Yes.
Yes, that's true. Where is the file? Okay, let's look for your file. Yeah.
Okay.
Well, first of all, you have to give me the position of the X-rays, then the area you are watching, then you can describe the specific place you are evaluating, and then you read me the findings.
Okay, I send you the message.
Yes, I receive it.
Okay.
About the labs, do you have something done?
I just have the part of the white cells. I'm going to send it to you.
Okay, perfect. Copy this.
Okay.
Perfect, I got it. Give me a minute to share a screen and then we can work on this, okay?
Okay.
Can you watch my screen?
Yes.
Okay, this is for example, this is right abdominal X-rays showing in the well, right low quadrant, and then your findings. And the right gas in the abdomen. Showing the right low quadrant. Some gas could be in the specific chart. Give me a minute to organize my idea. I'm running mad with this because I didn't open your file.
Oui.
No, don't worry. La, 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 la. Well, today is going to be a hard day, a long day, I mean.
Yes, but it's almost over. Over.
Yes, that's true. Well, almost over. Yes. Ay, se no quiere cargar. What? Okay, it's done. Let me share the screen again.
Okay.
Let me share it again. Okay, we have this.
Yes.
Yeah. Some gas with liquid levels, could we say? Levels, and some pieces without moving. Without moving at this moment. Then You can talk about the rest. The rest of the quadrants have pieces, some small gas. Yes. Bubbles.
Bubbles.
Small bubbles. And the gastric chamber looks filled. Looks more of gas. So could be an easy description about it. No more
Okay.
is needed. No more is important. What about the white blood cells?
That was
Yes,
my question. In the first one, there's only cubic millimeters, so
yes,
it's
it's
okay the
another.
way I wrote it down.
Yes, the idea of this, well, in homework, in quizzes, I think, we have an exercise to write it down completely, like you did.
Yes.
But when you make a report of this in the real life, in the clinical history, it's not necessarily to write it down. Just for practicing, I was asking for you to write down completely in homework.
Okay.
At this moment, everything is normal, right?
Yes.
So you can say, for making it easier, the reports are remarkable, are normal, or are within normal
Normal.
values. That's enough.
Okay.
You don't need to explain detail one by one if there are normal values. But if you
Okay.
have pathological finding, then you just talk about the pathological finding and you can finish the sentence saying rest of the labs are rest of labs reports are unremarkable, and that's enough. That's the idea we were talking about is, and well, this is the correct way to express is in order for not rounding ideas.
Okay. Yes.
That's the best
Because
way to do it.
when there is a patient with appendicitis, the labs are normal or there is something increased or decreased.
Depends on the situation and the time the infection is lasting. If you have a patient that is less than 6 hours in evolution, usually labs are normal, patient is without fever, just malaise, and not very intense pain, abdominal pain, I mean. But some other patients can stand this infection for around 1 day, 2 days without changes, just feeling malaise and cannot stand eating food, cannot go to the bath, or maybe start with diarrhea. It's a very common situation. Patients go with diarrhea and they are with appendicitis in another shape, in another variant, I mean. Labs start changing when patients get in complications. I mean, local peritonitis or appendicitis and necrosis, or, well, if you got a patient with a full peritonitis, it's more than 3 days that are with this situation. In the case, according to the report you sent me, your patient,
I think the patient is 8 hours, I think.
Yes, 8 hours is at this moment a good range. It's young. It's not with another pathological situations. They can stand without any trouble 12 hours around.
Okay.
So
Yeah.
it's usual, very usual to get the findings in the X-rays I sent to you. Some specific ultrasound findings, but ultrasounds can have more range of failing because the bubbles, the gas bubbles don't let to check all the structures. It's not possible if air is in the abdomen. They just cannot see anything. And X-rays give us the specific detail to solve it.
Yes. So when I have to diagnose appendicitis, it's better to use X-rays than labs when there is a short time.
No, the topic view, I can tell you, the most important part in appendicitis is the clinical exam, the evaluation you make. The diagnosis of appendicitis is by criteria, not by labs or X-rays or complementary tests. There is nothing that can say that. Maybe the CT scan could be a good idea to make, but it's not possible to do it for all of your patients. It's not able. By clinical opinion is the most important. That's why when you practice and start palpating patients with appendicitis, you have to take too much details and ask again and ask again, because you can get in confusion with pyelonephritis in males and females, of course, or with salpingitis or ophoritis or inflammatory pelvic disease or simply gas or a bowel colic. It's a very, very good chance to make the study. When you make an ultrasound, you have to be sure that the colleague that is developing the study has enough practice watching these structures, because sometimes it's usual to get it as a mistake.
Okay, so that's important.
Yes, not all the colleagues can check appendicitis, and not all the equipment has the good resolution to check appendicitis.
Okay.
For example, when I was working at the military hospital, I had a patient, teenager. He was 15 and he went alone to the emergency room, and he was asking for attention. He said that his parents didn't believe in him. I sent you back the corrections at the moment, okay?
Okay, thank you, Miss.
No, thanks to you. Work on this, get it better, maybe any more details you would like to add, and then send back to me, okay?
Okay.
So going back to the case, the patient with 15 years just go because he said, I have malaise, I know something is going wrong with me, please help me. And I said, what? Something is wrong. I don't know, I feel strange. And we said, no, it's not possible. Do you have pain? No. Fever? No. Something that it's different. How you could describe this? And he told me just, I feel something is not going okay. Please do something. I need to know what's going on with me. I asked for his parents. He was alone. Of course, it's unloyal to make research on a kid. It's not possible to do it. Well, but I decided to break the rules. I asked for some labs. I made the signature authorizing the lab tests. And he has just a little bit elevated the white blood cell count, no more. Nothing too remarkable, just a bit detail. And while evaluating again, he was starting with fever, 38 degrees Celsius degrees. And we said, well, something is wrong. Let's wait for the urinalysis. But my shift is over. So I left him with my colleague, the one who had to stay that night. And well, he called me and asked me, why you asked research in a kid? And I told him, because he feels wrong and something is going wrong. Let's believe in him, why not? He told me, okay, I'm calling his parents. I hope they don't kill us, because they are military. And I said, nothing is gonna happen. If something happens, please, I'm gonna go back to the hospital. But I prefer to believe in him, because when the patient tells you that something is wrong, well, do something. Don't just cross hands and wait. Okay, I'm gonna call you. Okay. 2 hours later, he called me and told me that his parents were mad, were yelling everybody, and said that this guy was used to make that kind of theater, they said. He was used to lie. But I said, no, he had fever and has not a good white blood cell count. Just wait for the labs, don't worry, everything's gonna be okay. When the lab reports came to him, he called me again and he told me, you have an angel in your bag, this guy has appendicitis. No pain, just fever, normalized, no vomit, no diarrhea. A very uncommon clinical chart.
Oh,
An
wow.
uncommon presentation. It was not a usual case. And this guy going to surgery. When they got into the surgical room, they were starting with in laparoscopic way, but it was lots of pus. They decided to cut the abdomen, open a big wound, and there was just almost a peritonitis. You can see that was a very complicated case. And that guy was, I knew something was wrong with me. Nobody believed in me in 2 days, but this doctor did. So who's here? And I said, okay, what happened? They called me next day and they give me the whole resume of the situation. I said, okay, it's better to believe in my patients. They are as strange like me. So you can see there is not a very common situation. And that guy was without pain.
Wow.
You could
That's
push
like
and
a
push
good
and push the
diagnosis.
abdomen, no pain. I asked for an ultrasound and the report was giving us that everything was normal. But while opening, the reality was different. That's why you have to recognize and to check which colleague is better for working with that kind of studies. It sounds
Yeah.
cruel, but you have to know who trust.
Yes. Wow.
And never
That's,
forget that guy.
yeah, that's a good story.
Yes, well, I have lots of stories, and one of the most, how you can say in English, I'm not sure about this term, but how you can say distóxico. I'm very distóxica.
No.
Yeah. You don't want to be in my shifts. My shifts are crazy. You can receive a heart attack, delivery, the last part of the delivery, just for catching the baby for not falling on the floor, not falling on the bed, on the emergency room. Once I assisted a delivery in the elevator. There was
Oh
no
my
time to go into the room. So anyway, the baby wanted to come. Okay, give me the gloves. I'm gonna stay in the bed, in the wound. And the baby just decided to born going into the elevator. Babies decide when to.
Wow.
My last parturition was in 2 hours. Nobody believed me, but that my baby was there, just going away. They told me, how 2 hours? It's impossible. No, it's possible. Look at me. I'm dystocic. Please believe me. And the doctor, she met me before in some shifts, and she told me, yes, your cases are so strange. It could be in you. We ran to the parturition room, and my baby was there. Her head was going away. And I said, I told you, doctor, I told you, please catch my baby. Don't let her fall down. The doctor didn't have time to wear the surgical gloves and anything. She received my baby by hands.
Wow.
And I said, oh, okay, you catch it. That's okay. Don't worry. I understand.
Oh my God. That's scary and exciting at the same time.
Yes. You don't want to be in my shifts. Nobody wants, actually. I have nurses that exchange the shift when they see me in the emergency room. They told me, you're a yes, who wants to exchange? With her, we can expect anything.
Oh
So
my
you
God.
have to be prepared for everything.
Yes.
Yes, and just open mind, nothing is common. In medicine, nothing is 2 + 2. Nothing. You cannot expect the clinical presentation with a specific patient, as the book says. Never. It's just a reference how patients come, but they are, of course, variables. Many different situations, or maybe the patient doesn't have any idea how to express how something is going, or like this guy, there is nothing that it's possible to find. Just cross fingers and make everything you consider necessary. It's better to make more than make less.
Yes. That makes a difference.
Yes, dear. So keep studying, keep reading, read as much as you can. And if there's any question, without any fear, ask. You can ask now. When you finish the career, there's no way about asking. It's not the same when you finish the university, the med school. You finish, it's on your hands to keep on working, to keep on studying, keep on courses, seminars, I don't know, congresses. You have to make the time to study, to be updated, and then get all the information. It's just your choice.
Yes.
But you're going in a good way. You are one of my favorites because you always have a question to do, and that's good.
Thank you, Doc.
Yes, never miss that opportunity to ask or to leave a doubt. Never. Don't be shy about it. Maybe doctors can be odiosos, yeah. Can be not too kind, but it's because this is a stressful career. You are not, at least at this moment, you are not living the worst part. To deal with patients is hard, and then you think again, is that correct for me? I want to kill that guy. It happens.
Yes, but we are here because we somehow like it.
Yes, we like it. We are done for this. We are going to say this. Never doubt about your capabilities. You are done for this career. If not, you were not at this point. Yes, go ahead. Don't worry. Everything is going to be great. Do you think
Thank you so much, Doc.
now? No, you're welcome. That's it.
Any specialty?
Yeah. At this moment, maybe something is calling your attention.
I find interesting dermatology and surgery, more surgery, because my dad is a gynecologist, so I went to a C-section with him, and it was very interesting.
Yes, it's nice. The C-section, no, I cannot be a gynecologist. It's not for mine. I cannot stand this. I want to be intensivist. I got the emergency, now I want intensive care unit. I like it. I don't know why. I feel happy there. Yes, I had the chance to work there around 2 years as the medical assistant. And well, the medical assistant does everything. The specialist just go for signature. Check just a change, a detail, say, okay, everything's okay, let me sign it, bye. Call me if there's a problem, yeah, and that's enough. And you have to make everything. And I fell in love with that.
Yes, it's interesting too, but you have to study a lot.
Yes, well, I like it. Patience. If you survive at the emergency room, you survive at the intensive care unit. You can do it. And it's not, well, I can see that it's not as hard as it looks. well, in my opinion, because I got on practice there. But not all the colleagues can deal with that situations. To connect
Yes.
or disconnect a patient to get on sedation without, well, changing the respiratory patterns, because it's your fact, not patient's fact. You have to choose everything and wait, have patience and wait the results. There are lots of studies how to get the intensive care unit a better place for patients, for not falling into depression, I mean, while being into sedation. They can hear and feel everything. So you have to take another way of talking, even though another way of
Oh, wow.
acting. And well, in order they hear everything, you can talk to them. Relatives, in my opinion, have the opportunity to get into and talk to them, and they get improved so soon. In Europe, they have programs that are not, well, intensive care unit is open. Walls are in glass, and relatives can visit the patient around 2-3 hours, but from the glass, not into.
Yes.
And they have the opportunity to talk with your relative by phone, because the nurse adjusts the phone to the patient, and they can talk to him, give support, and they improve so fast in comparison with patients that are in an enclosure placed. It's
Wow, that's
important.
interesting.
Yes, and then the therapy with music, playing their favorite songs, for example, changes the lab results. They run positive. They get improvement. So it's interesting. And you say how it works. Yeah, let's do it again. Yeah, take out the music. Yeah, let's play something that he doesn't like. Let's see the exchanges. Yeah, it's nice.
Yes, there are so many things to learn, so many things to prove.
Yes, lots of investigation that we can make.
Yes.
Well, dear, let's have patience. Please correct with the details I send you by WhatsApp.
Okay.
Prepare the file and send back to me as soon as you get it. When I receive it, finishing the workshop, I think, I'm gonna send you the lines of the letter of referral. Start reading this, and we can work on this on Tuesday, okay?
Okay. Thank you, Doc. Have a good night.
Well, thanks to you, and get improvement. Go ahead, don't worry. I trust in you.
Thank you, Doc. Bye.
Bye, Natalie. Well, at this point, Dr. Pamela was supposed to come, but he didn't attend. I'm not going to call anybody. It's not fair for me to stay as if they were kids. Well, patience. Let me answer some messages about homework, and then we are going to continue. Cute. Alejandro. Yes, Alejandro. Yes. Okay. It's 8 p.m. They're supposed to come. Oh no, Lucia was asking for coming late. I hope she can get in too. I'm going to mark the ones who sent homework. So let's wait a little bit. I'll be back in a few minutes. Don't go away. Hi, Juliana, how are you? Juliana,
Hi, Miss.
hi, how are you? I was missing you.
Yes, Miss, I have so many troubles those days.
No, everything is better. Is that okay?
Yeah, or today, is everything all right? So I am here in class.
Okay. Well, Juliana, we have lots of work to do with you. Do you
Yes,
remember I was asking for a case report? Do you remember
Yes.
that?
yeah. I have so many homework tasks.
Yeah, but don't worry. The case report is an activity that is at this moment without a deadline. So you can start working on this, and then when you get the case report and the physical exam, we can go to the second step, okay? Because
Yeah.
it's a hard job to do it.
Yes.
And well, I sent the slides. Did you have the chance to check the slides?
Just one. The other ones I didn't.
Okay, try to take the weekend to do it. Don't worry.
Yes, yeah.
According to that information, it would be able to complete the files I sent, quizzes and assignments.
Yes, Miss.
Yeah, but don't worry. I have some colleagues from the group that are with lots of job or academical activities, and they are asking for more time about sending homework, so there is no trouble.
Yeah.
Yeah.
Okay, Miss.
Are you okay, Juliana? I
Yes,
can't
Miss.
listen to you very well.
It's just I don't know. I don't know if it's a COVID or just a flu. I don't know.
Okay, don't worry. Do you want to take the rest of the session for go resting
No,
or
no.
sleeping? Is that okay?
No, it's okay. It's okay. I feel better.
Okay. About the case report, let me give you the details of this activity. I was asking for everybody to choose one of your patients in order
Okay.
to get more confident, I think, on the case, and then practicing the situation, practicing writing down with a clinical situation that is common to you, could be, okay?
Okay.
According to the findings, to the physical exam, to everything you write down. The second activity is to describe an image, could be X-rays, ultrasound, CT scan, MRI, depending on the situation. I send you back the findings, the lab studies, lab research, hematologist, I think, a sample of blood, and then an image. And according to that description that we work together, that reports, we can go to the third part of this exercise. That's why I'm working one by one,
Okay.
considering your own time, okay?
Okay.
Do you remember I sent a file that was giving you the general idea how to write down a case report?
In WhatsApp?
Yeah, yes, in the group.
Yeah.
Or if you need it, I can send you by your WhatsApp, your personal WhatsApp.
Yes, it's better. But I think I remember.
Okay, following that, write down the case report, and I send you a picture giving you some ideas how to write down the physical exam. Do you remember that?
Yes.
Following that picture, for taking a guideline, so you can write down the physical exam using abbreviations, the ones that we were watching in the module 1.
Okay.
Just do until that point. From that point, we are going to work ahead, okay?
Okay, Miss.
Okay. About the classes, well, just prepare considering the situation, considering all the slides. It's easy to answer the quizzes and assignments because everything is coming from the slides.
Yeah, that's right.
Okay, so I think that's all. Yeah, to give you a general view of this moment. Yeah.
Okay, Miss. I have to be al día.
Yes, you have to take this time for working because
I
well,
have
you
all the
have
weekend.
3, 4. You have 5 absences.
Yes, 5. Wow.
Yes, try not to be absent more time
Mm-hmm.
because it's not okay for your score.
Okay.
In this course, we have one chart for attendance to workshops and another chart attendance to theoretical classes.
Mm-hmm.
So this chart is one of the support charts, I think, because they help you to get better score. So
Okay.
don't worry, you're a good student, and your
Okay.
homework is
I
done in
was
a good
worried.
way. No, don't worry. Just work on the homework, and it's gonna be solved. Okay.
Okay, miss. Thank you.
Any question, please send me a message. Don't worry about it.
Okay,
And
miss.
I'm able to answer it. Don't worry. Here
Okay,
in
miss.
Bolivia,
Thank you.
we are starting Carnival. Yeah, the Carnival is from tomorrow until Thursday.
Tomorrow.
The first part. We have lots of days in Carnival, and then the next week from Friday, yes, Friday, Saturday, and Sunday are gonna be again the second part of the Carnival. It's a crazy week, but certainly I don't like that activity. So don't worry. Send me all the questions you have, okay? Don't worry about it.
Okay, miss. Okay. I send the request.
Thank you. That's for attendance. Thank you so much.
Okay, miss. I send it.
Okay, Juliana. Any question you have about it, about classes or a detail maybe?
No. I think you answered all my worries.
Okay, no, don't worry. I know everything is gonna be okay. Yeah.
Okay.
So I think we finish at this point. Okay.
Okay. Thank you. Thank you. Cualquier cosa ya le escribo.
Yes, as soon as
Yeah.
you have a question, no trouble. Send me a message and then we can talk about it. Okay.
Okay, miss.
The same order. If you finish, for example, the case report tomorrow or Saturday, you can send it to me and I'm gonna check it. And I'm gonna send you back the corrections, details, maybe to correct, and then we can gain time in order to work as faster as we can for not missing activities. Okay. Juliana.
Okay. Okay, miss.
Okay.
I'm here.
Okay. No, I'm not sure. Can you listen to me clearly? Maybe it's my web connection.
No, I heard. Everything is clear. I can talk very well.
No, don't worry. Don't worry. I'm glad you are coming back. I was worried. I
No,
was
I'm here.
expecting until today for asking the academical superior to get in contact with you.
Okay, miss. I'm gonna try to, I don't know how to say, ponerme al día en todo.
Okay, to get, I don't know actually. I'm gonna look for this and we can share this expression. Yeah.
I don't know.
Yes,
But
don't
miss,
worry.
thank you.
No, you're welcome. Thanks for coming back. You're a good student. Don't miss this course.
No. I was worried about that. I don't wanna miss the course.
Yes. Yeah. I
You
think
made me
it's a
feel
great.
better. Thank you, miss.
Well, thank you
I have
so
to
much. Thanks for your attendance.
Okay, miss.
So
Okay.
see you Monday. Get
Everything?
better soon.
Okay. See you Monday, miss.
See you Monday. Well, that was a nice surprise. Juliana came back. She was sick and she didn't send any message or said something. Well, patience in that way. I think she's gonna work. She's a nice student. Well, at this point, Karen is supposed to get into the class. So let's wait. I'm not going to call anybody by phone. It's not, they are not kids. So let's expect. Ay, Karen, I don't have anything from you. Well, let's wait a little bit. I'll be back in a few minutes. So don't go away. Well, until this point, yeah, I'm back. And I was expecting Karen. She didn't attend. Maybe she is in a personal activity. I don't know. She didn't say anything. Patience. It's not my attendance. And at this moment, well, Angelica came earlier. She's so lucky because the one that was supposed to be here was not attending. So it's like she exchanges the schedule. So let's wait a little bit for the next student. Okay. Next is Alejandro. Alejandro usually comes sometimes, so let's wait for him. 10 minutes. I'll be back in 10 minutes. Thank you. Hey Alejandro, how are you?
Hi, doctor.
Hi, can you listen to me?
Yes, I can.
Perfect. Again, playing with my camera from the cell phone and my laptop. Yeah.
Okay.
Well, you can work on this. That's okay. I
Okay.
received your letter of referral.
Okay.
Thanks for working on that, and thank you so much. I didn't send you the guides I was telling you. I didn't have enough time to finish this, but now I can share it by WhatsApp, okay?
Okay. I actually seek some examples in internet, so I guide myself for the things that I watch on internet.
No, that's perfect. That's a good job. And it shows that you are interested in doing this, and it's amazing. Thank you so much.
Well, I want to make my test in March, so I only have like 15 days or less to be prepared.
Ah, perfect. So give me a minute to download it, and then we're going to share for practicing, for checking, okay?
Okay.
So, the examples you prepared are well done. It's correct following the charts that some hospitals have. And well, that's okay. In UK specifically, they work with the example I was sending you.
Okay.
But that's okay. It's opening. And you send me the patient to me. Yeah, that's nice. Yeah.
I don't know what name you use, so and I'm sending to Bolivia. I hope I have a helicopter here or something.
Yes. Well, I hope some hospitals have the heliporto, yeah. But well, that's nice. Thank you for sending me a pediatric patients. Okay, let's make it bigger.
I have a question because I don't know if is the abbreviation of doctor is like Miss and Mister, because I don't know if English for
Yes.
female doctor I use DRS because
No,
I put DRA
just
already.
doctor. DR for everybody.
Okay.
Yes. Yes, that's an exception about the abbreviations, and doctor is for everybody the same. There's no trouble.
Okay, I put it in Spanish. I didn't notice.
Yes.
I put DRA.
Here you have some examples. Well, some ideas that are similar to Spanish, but that's okay. The first part, letter of referral or referral letter, that's the same. That's great. We can work like this. From you, from your place to your hospital, and then to me, to my hospital somewhere in Bolivia. Thank you so much. Garcia, thank you for seeing. Well, for seeing, it's not the correct example. For assistant could be.
Okay.
Thank you for evaluating. Or like we were talking in the example I was giving you. Do you remember this? I would be grateful if you would see. It's different, a different expression. You can see the difference. But the one you used, thank you for seeing, it's not very, it's similar to Spanish. But that's a good point of starting this, because it's just to change this detail. In the letter of referral, well, let me show you this. You have this first part that is perfect, it's well done. And you have a space that says patient's name. You give the
Oh.
patient the name, the age, and the sex. That's why during the explanation of the case, showing me the situation, you don't have to write down again the name, the same, similar to the case report.
Okay.
Like this. We'll see this. You can see this 50-year-old, and then start with the age, sex, and maybe occupation if it's necessary, right? With the same, here you need one extra space, but that's okay. Complaining of abdominal pain. How many hours is with the pain?
Oh, I forgot to put it. 9 hours.
No, don't worry, just a detail. It's important while talking abdominal pain. In right iliac region, fever and vomiting. Period.
Okay, how many? Okay.
That's all. That's the complaints. When you finish the complaints following this example, we have to go to a second paragraph, right?
Okay.
Sometimes, well, you support the complaints of the patient, and then in the second paragraph, you start with the diagnosis. In this case, acute appendicitis, and you can start this. His symptoms suggested, or his symptoms are in accordance of an acute appendicitis because, and then you give me all the reasons you have. First of all, the physical exam with the details you found. Yes, because you didn't tell me your findings. You have to write down the findings, the clinical facts that the patient has, then the lab tests, and finally the imaging tests.
Yes.
That's the order. Okay, but all of them answering that in the beginning, in the first sentence of the second paragraph, you give me the diagnosis. You have to support that idea, that's all.
Okay.
Yes, at this moment, the current medicine could be, and the legal chart, we can say the legal paragraph, because it's a boy, you can say his mother, Maria Lopez, is Maria, his mother, Maria, has the diagnosis, has knowledge about the diagnosis, the consequences, and she knows that the treatment is just surgery. That's all. A phrase like that, it could be useful because it's a kid.
Okay.
And that's all. Then you say goodbye or farewell, and that's all.
Well, actually, I have well, in this example, I use appendicitis because it is one thing that everyone recognize easily in medicine. But when
it's very common.
I feel like something that I am not enough information for making a diagnosis, how can I make that referral? Because, or can I make that referral without putting a diagnosis?
No, you have to support the diagnosis. You have to take in account a reason to send to the specialist a patient. You can say, that's why in the second paragraph you start supporting why you are sending this patient. No matter the complaints at the point. The complaints are just supported that you are not able to treat this patient. You can say here, this verb is very important, suggested. But not suggested, not in past. The patient or these symptoms suggests, or in my opinion, the patient could have something, an expression that can leave an open door, we can say, about a different diagnosis that instead the one you are talking about.
Okay.
Or you can say at this point, or with the information I collect, the symptoms suggest, for example, I don't know, a urinary infection, a pyelonephritis, but following the lab tests, at this point, I don't have, for example, ultrasound to give more details. I'm glad if you can complete the studies and then check the results for solving this situation. Something like that could be useful.
Okay. I will practice more because part of the
Yes,
test is the referral. So I will try to
yeah,
make one per day or something.
try to write down. Now you have the idea how to write down the complete situation or to prepare the letter of referral. And then you can send it to me as an extra job. That's okay for me. We can practice and practice on this point.
I will
That's
do
okay.
it this one again and try to, because I feel that I don't have too much vocabulary. Is like too much simple, sencilla. I
Don't
wanna.
worry. At this point, it's enough to understand.
Okay.
But of course, as you say, it's better to get more ways of expression on this, and this with practice.
Okay.
So don't worry. Let's start working on this. This first letter of referral, I'm asking for you to do. We are doing it together. We are taking enough time to write down, to correct, to check more expressions and details, right?
Okay.
We have 2 more letters of referral in next homeworks, and that job is gonna be done by your own,
Okay.
following the examples I'm giving you. It's gonna be useful. It's for a score, so taking in account the information we are catching in module 2, it's possible to write down every letter of referral, case report, or everything we are doing in a better way. That's why I was telling you that all the module 2, we are going to write a lot.
Okay. Well, I need that because
It's
I want
useful.
to do my test in the next month.
Wow, just 1 month. Wow.
Yes, in March,
Which
because
date?
then for the opportunity to do the flap one, the other test, the how do I say, the coupons go fast, so I have to try to get one in this year, so I have to pass the OT faster than I can.
Yes. Yes. Do you consider it's enough time to prepare to you?
Well, I
Well, at this
I think
point,
I think that I can. It's enough
yes,
time. Like
the
15,
idea
20
in,
minutes is enough.
yeah, I tell you by experience, the idea in any language is just to make you understandable.
Okay.
If you can get in communication, that's enough at this point. But these rules in expression in medicine, well, they are helpful because the course is helpful, but the time is not enough to get in a better result, I think.
Yes, it's
But
like
well,
only 3
yes,
hours by week, but by the way, we have to study by ourselves.
yes, but even though I learned how to write down the clinical history in around 1 year, that's why I'm asking you to do that. Let's
Okay.
work on this. Let's prepare to your test. That's okay for me.
Okay.
Okay, so you have one way in the letter of referral you write down, one way to do it that is correct, but you have to consider the place you are going to work on. In USA is different, in UK is different, and well, of course, in Bolivia it's very different from this. In Honduras, of course, it's not the same.
Actually, we write so much more and describe more things and a lot of more, but
Yes,
you tell us that is more short in UK and US, the way of make this notes and things.
It's easier. They
Mhm.
just go to the most important point, and that's enough. In UK, in USA, well, in other countries, it's easier to make, but in our countries, we have to round a lot and support more ideas than sometimes we expect.
Okay.
In general, it's a good job, but we have to add important details like the time that it's lasting the pain, for
Mhm.
example. And in the first paragraph, it's not correct to talk about treatment and lab reports. It's mixing, it's similar to Spanish. That's why it's not correct. You are mixing information. You have to get the chronological order of the events you are working on. First of all, you receive the patient and listen to the complaints. Then you make the physical exam. Then you ask for complementary tests, sample of blood, lab tests, the ones you need, imagine tests. Following all of this information, you get the diagnosis and then the treatment. According to all of this, in the same order, you write down the letter of referral.
Okay, I will try to do it again right now, and I'll send it to you.
Okay, correct it. I have some students that are not attending. So in that way, when I receive the referral, I'm gonna check it and send you back the details to improve this maybe, or if that's okay, or if that's better, okay? Now I think you have a bigger idea how to do it.
Okay, yes.
Okay, about the lab test, the values are not important at this point. Why not? Because you're going to send a copy of them. That's usually in other countries to send a copy. Or if you want to give details like the values, you have to support why you are doing this. For example, at this point, I send you the values of the lab result, the lab reports, because we don't have the option to send you a copy, for example. You have to emphasize why you are doing this, because it's not the way to write it down, at least in the way I was learning how to do it.
Here in the public health system, we don't.
Yes, we have to do it.
The lab test is only in the experience, and we don't have like photocopies or print
Yes,
machine.
yes.
We always write.
If you are going to UK, you're going to have more than that.
Yes, I know, but
So it's not, at this point, it's not a fact to send the value, so don't worry about it. Just the most important ones as you did, but explaining, for example, white blood cells count was elevated or was with unremarkable values or something like that, or everything in labs were normal. So the ultrasound showed findings according to an acute appendicitis.
by the way, I don't know if in the UK or US they use the scales like Alvarado scale that
Yes,
we use.
everything is with scales, everything. You have to give a criteria.
Okay.
But you can say in the Alvarado scale or following the Alvarado scale, we got, I don't know, 8 points. For example, I don't remember exactly the value. I have to be sincere with you.
Okay.
We got all the points, for example, and we support the Alvarado scale following this, and this. But the Alvarado scale is at the end when you support or following the Alvarado scale or according to the Alvarado scale. The diagnosis is an appendicitis. That's why an acute appendicitis. That's why, in my opinion, the patient needs a surgical treatment, and the mother, in this case, it has the correct information about it, and that's enough.
Okay.
You have to be as brief as you can, just going to the point.
Okay.
So it's a good job, I think, a good way of starting this. You're doing a great job. Thank you so much. And the letter of referral. You're the only one who sent it.
Okay.
Nobody else did.
I don't know, this is the other partners are applying for something at this point, or just start to be prepared?
Yes. No, that's a plus for you to prepare this. So start practicing. Try to correct it now.
I will.
I'm gonna check some details in the file I'm preparing, and I'm gonna send it to you as soon as possible. Okay?
Okay. Thank you, doctor.
No, thanks to you. Thank you for being interested on this activity, because it's important. It's very important, and following your facts, your plans, you are running, you are rushing.
I have to.
Yes. No, that's okay. So let me correct this, and I'm gonna send you back. Okay?
Okay. Thank you, doctor.
At this point, the classmate was supposed to come, maybe might not. So let's wait. Okay, I sent you the pool. Can you watch it?
Yes.
Perfect. Okay, thanks to you. Thanks for the attendance. It's done.
Okay. See you, doctor. Thank you.
Okay,
night.
try to correct it now, please. The file
I'll do it.
with ideas. Just be creative on the vocabulary, and don't worry, any expression that it's mixed, maybe we can correct it and it's gonna be better for you. Okay?
Okay. That's okay.
Okay, so see you later.
Okay, doctor.
Well, at this point, yes, let's wait. Dennis was supposed to come now, but he told me he's on duty at his hospital. He told me last workshop he's out of time, and I understand. Just wait. If he doesn't come, Luis, I hope he might come. He was not yesterday. It was a surprise. But patience. Let's wait a little bit. So I'll be back in some minutes. Hi, Luis, how are you? Can you listen to me?
Hello, teacher. How are you?
Fine, how are you? How was your day? Yesterday I didn't see you in class.
Sorry?
Yesterday I didn't see you in the theoretical class. Is everything okay?
Teacher, I couldn't. Yesterday was my birthday, and
Oh, congratulations. I didn't
celebrating.
realize that.
Thank you. I was with my family, and we eat hot dogs. And
Yes. No, don't worry. You have to celebrate that.
thank you. I'm going to read the class.
Okay, so I sent everything now. And well, patience. Just check this. Did you have the chance to check the information?
Just the homework of the referral. There are referral.
Well, which one?
The letter of referral.
Ah, yeah, the letter of referral. No, I
Okay.
didn't send the guidelines yet because I'm expecting some 4 more classmates. But until this point, I'm still with 3 students with information. So I'm gonna send it tonight. I cannot wait 2 more.
Okay. I didn't understand then because I made it.
Okay, it's better. If you got this information, it would be nice. Please send it to me by WhatsApp and then we can work on this and correct it. It's gonna be a step ahead from you. That's perfect.
Okay. I'm gonna send you. Okay.
Perfect. Hi. Give me a second to download it and then we can work on this, okay?
Okay.
But that's nice. If you did it, it's perfect. Yes, I got it. About the quizzes and assignments, is everything okay? Did you have the time to work on this?
Yes. Yes. Maybe some of the questions are were difficult, but I think I made it good.
Perfect, because you didn't send it to me yet.
Okay.
No, don't worry. Send it as soon as possible, okay? Because I have the whole weekend to check it.
Work, but I'm going to send you when I in my house.
Okay, don't worry about it. Okay, can you watch my screen? I'm
Yes.
sharing your job. Yes, perfect. Dear doctor, I would be grateful if you would see this my patient who was playing soccer when he suffered. This off is not necessarily when he suffered an extra forced inversion of the right ankle, after that, he started with too much pain on his ankle and inability, and it's not possible to walk. And this OE on exam, it's not necessarily. The first paragraph has details in grammar, but the general idea is well done. That's correct. This first paragraph, I like it, okay? Just correct some details in grammar that I'm giving you while reading, okay? So take them in count. When you go to the second paragraph, you don't write down as if you were talking with the clinical report, right? You have to start giving the diagnosis.
Okay.
Let me show you the example we have. Where is it? In that order. For example, here, his symptoms suggested, and then the right angle fracture, or the way you're written down your diagnosis, because the findings support this by, and then all the medical terminology. Or you can say, and this was confirmed by examination, and then you describe the findings you have. Because with the beating edema, ecchymosis, open wounds, deformity, tenderness, crepitus on palpation in the lateral malleolus, and then you copy the physical exam, right?
Okay.
Did you make a copy of this second paragraph?
Yes, just I next.
No, that's okay. In order to start doing this, you catch the idea. In Spanish, we make a copy of the physical exam. We as Latinos used to make this, but in English, it's not possible. In English, as I was telling you, the letter of referral is a letter sending a patient to a specialist or to another doctor. In that way, you don't have to copy exactly the same ideas. That's why you start at the beginning with the diagnosis, and then with all of the research you made, you can support the diagnosis you send at the beginning. Okay?
Okay.
So you can say as following the example. His symptoms suggested right ankle fracture, and this was confirmed, or this was supported by my examination. You take the responsibility about it, of course. By my examination, which revealed, and then you give all the findings you have as a list. Okay?
Okay.
In the order you send that list, you can support the physical findings by the labs at the beginning. For example, you can say, following his symptoms suggested a right angle fracture, because all of the findings are, and then you give the list. Moreover, the X-rays show, and then you describe the X-rays in the way you did last class, that it was correct. Do you remember that?
Yes.
We were talking about it, and it was a good explanation about the X-rays.
Yes.
And then, because the X-ray show, you give all the details of the X-rays.
Okay.
Finally, in my opinion, it's this patient needs a surgical treatment. That's why I asked for these labs, for example, and then I asked for example, pre-surgical labs that are within normal limits, that are normal, or that are with unremarkable findings, and that's all.
Okay.
So you can see the second paragraph, in order you copied this. It's not correct at this point, but don't worry, we are learning how to do it. So just correct it, and that's enough.
Okay. I understand.
At the end, that's a good point to do this carefully. Dr. Liz Ochoa, thank you, and that's all. Well done, good job. Is there any question about it?
No, I understand the idea and I
Okay, I think
can
that's
make the corrections.
perfect. Try to do it now in order to correct it, to check it. And in order the workshop is going ahead, I'm gonna send you the file that I was talking to you, okay?
Okay.
So I think that we have almost everything done, right?
Okay, teacher.
And congratulations for your birthday. I hope you had an amazing day, an amazing week.
Yes, thank you.
And go ahead, you're a good student. I'm glad to be working with you.
Okay. Thank you.
Okay, so let me show you the pool. Okay, can you watch the pool?
Yes.
Perfect.
Okay, right.
Thank you so much.
Thank you, teacher.
As soon as you finish the quizzes and assignments, please send it to me, okay?
No problem. Thank you.
No, thanks to you. Thanks for your attendance and all of the interest on the class. Because you and one of your classmates, just two of the whole group, are on this point working on the letter of referral. Rest of the people are still on the second part or maybe at the beginning.
Okay.
So you're gaining enough time and that's the best.
Thank you. Thank you. I'm
Yeah, you're doing a good job. Don't worry about it. I know you're making a great effort because combined job and studies is not easy.
yes. But
So go ahead. Never stop working like this. Your patients are going to appreciate it so much because you are prepared.
that's true.
Okay, Luis. So let's go for working, okay?
Okay.
Okay,
Thank
let's
you.
see you Monday.
See you next week.
See you next week. Bye, Luis. It's always nice to see you.
Mm.
Yes, well, at this point, Luis is doing his best and this effort is gonna give a good result. Dennis actually didn't come. Maybe he's still studying at the university. He told me he's out of time. That's why I understand the situation. And well, let's wait a little bit. I'll be back in 2 minutes more. Thank you. Hi, Ivana, how are you? How was your day? Hi, how are you feel? Thanks for sending quizzes and assignments.
Next, what did you say?
Thanks for sending the homework.
Ah, okay.
Okay. So let's see. Did you have, well, at this point, I didn't send you yet the file with the topics of the letter of referral because I finished writing it down. And I only have 3 students that need it, and I was expecting some more people. Well,
Okay.
in there, yeah. Did you have the chance to try to work on this, maybe?
Right now,
No, maybe during these 2 days, did you have the chance to try to write down the letter of referral? Because we were talking about it a little bit. Do you remember that?
and yes, do you will send the
Yeah, the
example?
guidelines, but I didn't finish them. I'm sorry. I'm still expecting some more students to do it, but I'm gonna send it tonight. It's ready.
Okay.
Let's try to do it now. Just a paragraph for practicing, okay?
Okay.
For example, yum, yum, yum. Yum, 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 yum. Okay, give me a second, please.
Okay.
Yum, yum, yum. I'm looking for your file. Yes, that's correct. Yum, 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 yum. At this point, my laptop is a mess. I have to reorganize this. Yes. You remember we were working on the second part of the job
Okay.
about the x-rays and everything. Ay, ay. Where is that?
When is the exam?
And the exam is on March the 2nd.
Okay.
It's gonna be on Thursday again.
Um, 2 weeks.
Yes, in around 2 weeks. We still have 8 theoretical classes more, and then we have the chance to get on evaluation again. Yes, here's the file. I was mixing information. Okay, Ivana, did you make any correction to the second part of our job?
No, I only write
Yes,
what
yeah.
I only write the description that you say.
Okay. Now let's try to work on this. And well, you have your original file, yes.
Yes.
Please preparing the letter of referral.
Okay.
Do you think it's possible now? Let's start
Yes.
with this. Let me share your screen for showing you an example. The example we were working. Okay, can you watch my screen?
Yes, I can watch it.
Okay, following this example, try to write down your case, your letter of referral in a file now, just for practicing. We're going to correct until we get it, and then you are going to continue working, okay?
Okay.
Okay, so let's start doing this. And As soon as you finish, please let me know to check. Okay?
Okay. It's fine.
Well, as soon as you finish writing down, please let me know to let you share the screen, okay?
Okay.
Okay, Ivana, how is it going? How is it going? Is everything okay?
Yes, in 2 minutes, I think I will finish.
Okay, let's go.
I finish. Okay. Mm. 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 I finished it. I, mm.
Ivana, can you listen to me?
Yes.
Okay. This years old, please erase this. It's not necessarily because just a baby with 5 months, right?
Oh, it's true. Mhm.
Don't worry. Congestion, okay. 2 days later, she said, okay. From this part, here, the symptoms of her symptoms is the second paragraph. Can you move this, please?
The symptoms. Mm.
Yes, no, go more.
Eh,
More. Go ahead.
Mm,
Without improvement until today, we are in the Rodiplox line.
okay.
Yes.
Ah,
Yes. His symptoms, her symptoms suggested. This is the second paragraph. So from that point, yes, his symptoms, from this expression, his symptoms, go to move to the second paragraph. Perfect. Suggested laryngotracheitis, acute laryngotracheitis, right?
laryngotracheitis, what?
His symptoms suggested acute laryngotracheitis,
Ah, okay.
and it was confirmed by my physical exam. Okay, my physical exam, and then you support the findings you have. Did you get, for example, the thorax retraction while breathing? You got the palpitations, the lack of oxygen, then well, all the findings you have in a chronological order, you can add to the letter of referral.
Okay.
Okay, just the positive ones. If some data is not positive, don't add this. It's not necessarily. Okay, it's convex. Okay, with the physical exam, by my physical exam, where I found all the findings. Okay.
And I'm looking. Midline.
Perfect.
Only.
Okay, by a physical exam, I found Valteronchi last treated without the stethoscope with sinal costal retractions. This end goes up, a perfect comma. There you have to add a comma. And X-rays show, not that reveal, just show. And X-rays show characteristic subglottic narrowing of the airway. There's a dot, perfect. You can say moreover, or you can say lab tests are normal because you took a sample of blood, right?
Yes.
Yes, the sample of blood is normal, or in the sample of blood we have these findings, and then you start with all the report of the clinical report.
Okay.
Okay. The sample of blood reports. The sample of blood reports normal values, not normal limits. Okay, the sample of blood reports normal values. That's the second paragraph finishing this part. Then you go to your farewell. You have to say, taking for example, how you can say that sincerely, and then your name, for example. It's a polite way to say goodbye. Or you can say, giving you all this information, I'm sure the patient is gonna recover or something like that. And then you say goodbye to the doctor you are sending the patient, right?
Can you repeat of all this information?
Okay, following this information. Mhm.
I following this information.
Yeah, following this information, I'm constructing the idea. I'm lost idea. Following this information.
My grateful.
Yes,
for
following this
attending-
information.
For attending my patient.
Yes, thanks for assisting my patients. My patient. Thanks. Thanks for assisting my patient. Yeah. Okay. And then your name?
Okay.
And that's all.
Okay.
Is that, it's not as hard as it looks, right?
Okay. In the date.
Yes, the date, of course. Perfect. At the beginning of the letter of referral, can you go up, please? Yes. Previous to this letter of referral, you can erase it. It's not important. For example, you can say Dr. Pepito Perez, and then you explain the charge he has, pediatrician, for example. To Dr. Pepito, pediatrician, from Dr. Ivana, general practitioner, for example.
I write that.
Yes, you have to add that information, and that's all. It's done. Yes.
It's on, okay.
Doctor, the name you like, the doctor. Yeah, you can choose that. No. Oh, thank you. But no, previously to this part, no, from that name, from that part, erase just the dear doctor is the expression we can use.
Erase what part?
Yes, erase that, my name from that part, erase this, it's not necessarily there. So
Okay.
go to the previous space. Go up.
Okay.
Upper, and upper. And then you write down doctor, the doctor you like. Thank you for your confidence.
Can I, doctora? Only doctor.
Yeah.
Only
No, Dr. Iris Garcia. And then following that, in the second line, write down my specialty in this case. Anyone. Would be pneumology, pneumologist, pediatrician, I don't know. Okay. Then let's go. Let's keep on working on this. No, it's with a P at the beginning. Yes. Well, but that's pneumologist. Then make a press enter when it says pneumologist twice, press enter twice. And then write down your name and your specialty. The first one is to Dr. Iris Garcia from Dr. Ivana Vargas. General practitioner.
It's right.
Yes, practitioner. Yes, that's the way of writing down this. Go press enter again.
Okay.
Yes, the first one, The neumologist is to, para, to, from, desde, Ivana, and that's enough. No. Go up again. Go up until my name. Until my name, go up. No, go up. Here, yes, next to my name, write down 2 points, and then my name. No, at the beginning.
Okay.
Don't worry, it happens too. Perfect. And then in your name, from.
Okay.
Perfect. That's
I will-
done. Everything.
I will research this word.
Okay, record this. Yes. That's all.
Okay.
That's a good letter of referral. Please send this file to me in order to get your job, and check again. And if there's more expressions to write down, I'm gonna give you the suggestions, okay?
Okay. Thank you, Iris.
Okay. Please be sincerely. Is that easy or hard to make?
It's easy.
Easy, right?
Right.
It looks easier because you were practicing on the case report and physical exam and all the descriptions we are making at this point. If you get
Yes.
all the information in that chronological order, it's easy to make.
Yes. Yes.
So please send me the file now to me.
Okay.
And I think that's all at this point.
Thank you.
No, thanks to you for your interest in doing this activity. Let me send you the pool.
Okay.
Can you watch the pool now?
Yes.
Perfect.
The person next
Yes, next to you didn't come. She's not
didn't
here.
come.
No, she's not here. Well, actually here in Bolivia, we are in Carnival. Maybe she has an activity or something like that, but patience, yeah. Thank you for the pool. You are so lucky, yeah.
Okay, I will send the refer.
Listo. Send it to me, please.
Goodbye.
So, goodbye, Ivana. And you send me quizzes and assignments. Perfect.
Have a nice week.
You are one step ahead from the rest of the group. Keep on this way of working.
Okay.
Okay, have a nice weekend too. And see you Monday.
See you Monday.
Bye-bye. Okay, at this point, I'm expecting Natalia Ramayo. She just finished the university class and she's running home. She asked for that. And well, let's wait a little bit for her, or maybe Dr. Kundemaita, or maybe Lucia. Lucia was asking for coming at 10. Well, let's wait a little bit. I'll be back in some minutes. Hi, Natalia. How are you?
I'm fine, teacher. And you?
Fine. Well, today without camera, my camera is failing, so patience.
Okay.
I'm
Okay,
out
teacher.
of video.
It's okay.
Okay, my dear. So let me know, is that okay, this schedule for you?
Yes, miss, I think it's better because I just arrived home right now. Yes,
Okay.
miss.
Okay, perfect. I'm going to change it into the schedule because I'm moving some colleagues. You are going to be at 10. Is that okay at 10, right?
Yes, miss. 10 is okay. Thank you.
Okay. Okay, perfect. No, don't worry about it. To get in order and reorganize a few details of this.
Okay, miss.
So let's check. Do you remember we were working on the case report and describing X-rays and details like that, right?
Yes, miss.
Did you have the chance to work on the second part of the job?
Miss, not yet. Today I'm busy all day. Not like
Yes. No, I understand, but try to do it as soon as possible, please, in order to work on the letter of referral,
Yes.
because I just finished the file giving you some ideas how to do it. It's
Okay.
like a guideline. It's very easy to understand. And
Okay.
following examples, it's easier to make, but we need that description in order to get the letter of referral in an easy way.
Okay, miss, I will do it.
Just try to do it in order to your time, but please as soon as possible, okay?
Okay, miss.
Okay, about quizzes and assignments, did you have the chance to finish this?
Yes, miss, I think, but I haven't sent you. It's till today, miss?
Yes, until tonight, until midnight, but I understand you are out of time. So send it to me tomorrow if it's not possible to do it tonight, okay?
Okay, miss.
So don't worry about it. I understand. At the university, everything changes.
Yes, teacher. It's difficult.
Yes. So don't worry. Try to do it as I was telling you as soon as possible, and it could be great. Okay?
Okay, miss. And I have to correct the case report. What I have sent you or no?
Actually, let's open the file. And then we can check this, okay? Give me a minute, please, to find your file.
Okay.
I opened another one. Okay, do you remember we were talking about it, that you write it down the physical exam as if you were telling me a story?
Yes.
Yes, that's not the example we are using, because in the clinical history, in the clinical report, you don't have the chance to work like this.
Okay.
I mean, you have to organize the ideas similar to the picture I sent to you. Do you remember that one that we were using in the class?
Yes.
Following that format, that way of writing, try to correct the physical exam. The information is correct. The order of the ideas is well done. Just the way of expression is the trouble, okay?
Okay, miss.
Okay, let me share the screen to show you the example, and it's gonna be a better idea how to correct this, okay?
Okay.
This is your case report. Can you watch my screen?
Yes, teacher.
Perfect. This is your case report. You see, on examination is, well, it could be, but it's better if you say on exam, or maybe on physical exam, if you want to write all the all the sentence.
Yeah.
But if not, just write down this abbreviation OE on
Okay.
exam.
Oh,
Following abbreviations is easier to make,
yes.
right? When you write down this, you have two options to follow. Start with the temperature, of course, because it's the first vital signs you have to write down.
Mhm.
And then following the American clinical history, you can write down all the vital signs in this first line. If
Okay.
you follow the British format of the clinical history, you have to write down the vital signs before some descriptions, before some details, or maybe in the system that each one performs. For
Okay.
example, in the respiratory system, the respiratory rate. The cardiovascular system, BP, and heart rate and pulse.
Okay.
So it's similar to the clinical history we make here in Bolivia, right?
Okay.
In your description, we have this, the saturation, the oxygen saturation, his lack of oxygen. So it has to be in the respiratory system. That's why I need you to reorganize ideas of this paragraph, okay?
Yes, Miss.
System by system that are evolved here, and that's perfect.
Okay. With abbreviations, right, Miss?
Yes,
Not
with
the
abbreviations
whole
could be
word.
better.
Okay, Miss. And the order of how I can do it is it in the guideline?
No.
You know? Oh.
And well, in order this course is prepared for graduated doctors, I mean, we have to, well, we know that we have a logical order of the systems. We go
Okay.
from top to toes. So
Mhm.
in that way, you start writing down, for example, talking about systems, respiratory system, cardiovascular system, abdomen, urological system, gynecological system, depending on the case, of course,
Okay.
then neurological system, then osteo and muscular system, and finally the nervous system.
Okay.
That's the way. I
Okay,
can
Miss.
send you a message to follow this order, and then taking that information, you can reorganize these ideas. Okay?
Yes, please, Miss. I don't know yet how to do a case report, even in Spanish. Not yet.
Yes, that's why it's difficult, more difficult to you. And I
Miss.
understand this. So don't worry, we are going to work on this. This is
Okay.
just a general view for you. It's
Okay.
not the big point, because you are not practicing in Spanish and it's harder, it's too much harder.
Yes, Miss.
But when you make it in Spanish, if you compare the information, you are going to see that, to know this, that in Spanish, we round too much in ideas.
Yes, yes.
We repeat information a lot.
Yes, Miss. Okay.
So don't worry. Let me send you the order of the systems, and then we can work on this, okay?
Okay, teacher. Okay.
Any question about this?
No, Miss, I think it's okay.
Okay,
That's
so for example, peripheral cyanosis, which part of the report you can express this?
Which part?
Yes. When you are into the exam, you have the general symptoms, could be said.
Okay.
And in the general symptoms, you can talk about the color of skin, if there is cyanosis, like in this case,
Okay.
or if there is jaundice, that yellow color in mucosa and skin and eyes. Yeah.
Okay.
It depends on the situation, where to place, depends the system you are evaluating, depends on the clinical thought you have to organize these ideas. It's the same in Spanish. And
Okay.
while practicing and practicing, you catch this, and it's easy to make.
Okay, Miss.
But don't worry. The first part, the case report as a fact, is well done. Don't worry about it.
Okay, teacher.
Just try to practice, and if you find another way to say the same ideas, that's perfect to me, because while finishing the letter of referral, the whole exercises we have with this case, this first case, you're going to write everything by your own.
Okay.
At least two clinical situations more in order to get in touch with all of the activity, I mean.
Okay. Okay, teacher, I will practice.
Yes, any question, Natalia, send me a message. There is no trouble. Don't worry about the time. I'm always connected to the internet.
Okay,
So maybe I take few hours or minutes to answer, but I'm going to send you the answer. Don't worry.
okay, Miss. Thank you. Thank you, Miss.
Okay, thanks for your attendance. You ran from the university.
Yes, Miss. I ran for the class.
Oh, thank you. Thank you for the interest. I sent you the pool,
Yes, Miss.
and we are going to expect. Yeah. So I'm going to change the schedule, and you're going to be at 10. Okay.
Okay, teacher. Thank you.
No,
It's
thanks to you. Don't worry.
okay,
Don't worry.
Miss.
Thanks for your attendance. Is there any question until this point?
No, Miss. For the moment, no. Think.
Okay, that's great.
Okay, Miss. Thank you so much.
No,
See
you're
you
welcome.
next week. Thank you,
See you
Miss.
Monday.
See
I'm
you.
gonna send homework tomorrow night, okay? This
Okay,
homework is gonna have 1 week again, so don't worry about it.
Okay, Miss. Thank you. Goodbye,
Okay,
Miss. Have a good
Natalia,
night.
have a good night too. Goodbye.
Thank you. Goodbye.
Yes, Natalia attended. Now I'm expecting Dr. Condimaita and Lucia. Maybe Lucia can come. I don't know. I'm not sure about it. Just wait. The last 2 students. Last 2. I need to finish this. Okay, let's wait a little bit. Let's see what he sent to me. Sequence. Okay. Hi, Lucia. How are you?
Hi. I'm fine. Thank you for making this exception for me this once.
No, don't worry. You always attend the class, but I was expecting you in a few minutes, but that's okay. Let's start. The classmate
I
that
thought
it's supposed to
maybe
be
it's
is not
way too
here.
late then. Okay.
No, don't worry. Let's start now. It's better.
Okay.
If it's
Let's
earlier,
start.
it's better. Okay. So, my dear Lucia, thanks for your attendance.
No,
I
thank you for
go.
making this exception.
No, I understand. Sometimes these situations happen.
Yeah, but
So,
I'm sure it's the last one, the first and last.
well, actually, there is one student more that
Oh.
is supposed to be at this moment, but he's not here. That's why I told you. Well, at 10, there was no one. But
Oh.
at 10:30 until 10 to 10:15. 10:15 to 10:30, there's supposed to be one student. And to 10:30 and ahead, we don't have no more.
Oh.
But don't worry, that's okay.
No, I did my best to get home on time and connect to the Zoom meeting.
No, that's okay. Don't worry about it. Okay, my dear Lucia. Nom, 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 nom. Did you finish the corrections of the last file we were talking about?
Oh, the file. I did not touch it, but I was kind of focused on reading this X-ray that you sent me, like the part 2 CRMPE file, and I cannot find what's wrong. I mean, you told me to look into the bronchi, but I don't know. I feel like kind of dumb because I can't diagnose it. I mean, I tried. I started to write the report of the lab test, but the X-ray, that really got me thinking, and then I left it and focused on the assignment and the quiz that we were supposed to deliver today.
Yes, I
And that's
received
it.
yours, and that's great. Don't worry about it.
Mhm.
Don't worry, I understand. Let's try to work on this description. It's been harder to you, right?
Yes.
It's not so clear. So, well, as I was telling you at the beginning,
Mhm.
this is one of the typical images from COPD. So let me see. Can you watch my screen?
Yes, I can.
Okay. Let's make it bigger because we have to check details. I asked you about making anatomical details, I remember, and
Mhm.
well, anatomical structures, if you can't see them, but it's not easy at the beginning because I'm not teaching you a normal X-rays.
Mhm.
That's why you cannot find the difference with the pathological X-rays.
Mhm.
So here, let's work it together.
Okay.
Let's use Google too. Google is the best. My friend. You are checking my attendance, yeah. Attendance to the class.
Oh yeah, I just saw it. It's I think your screen sharing is a little delayed.
No, don't worry.
But I got to see my name.
Yeah, don't worry, that's okay. So this one.
Oh, yeah, that's the one.
You can see this one here, right?
Mm-hmm.
Let's compare with this. Let me take a picture of this to make the comparison.
Okay.
Give me a second, please.
No, don't worry.
When you make the comparison next one to the other, it's easier to catch the difference. When I was at the med school, I had a full class where you only have the image, the X-rays, for example, and you have to give the diagnosis of this.
Oh.
That was awful.
Yeah, I can imagine.
Because you only received the X-rays, and the doctor was used to tell me the difference. Okay, you were finding the differences. Okay, now tell me the diagnosis. What? I don't have the clinical findings. I don't have the clinical situation. No matter, give me the findings. Following the changes you have, give me the diagnosis. What? The best way of learning this is making the comparison between a normal X-ray to a pathological one. So let's work on this, and it's going to be easier for you to make the description, okay?
Okay.
Try to take some ideas or maybe to write down them in order to practice, okay? I know it's so previous to you because you didn't take that class at the moment at the university, right?
Right.
So don't worry, let's go. It's gonna be a step from your classmates.
Oh yeah, that's for sure.
Yes, but that's great. So let's start. Tell me the differences you watch between the normal one from the pathological one. Don't worry about the order or the structures or anything. Tell me any idea you have, that's okay. And from that point, we are going to start.
Okay. First of all, you can, like, the first difference that you notice is the size of the lungs and the heart. Like, you can tell just by the first look that in the normal one, the lungs are occupying the whole thoracic cavity, and the heart is really, like, you can see the, how to say it, like the apex. Yeah, apex.
Yeah.
It's rounder than the one that is a pathological one.
Perfect.
Mm-hmm.
So
Then,
first of all, you have the size of the lungs, right?
Mm-hmm.
You have the shape of the whole thorax, right?
Yes.
Follow the difference. Just talking about lungs, tell me the difference you find.
Other than the size, you can say that that they are like, how can I can find a word, like,
Tell me in Spanish if you cannot find the word. I can help you.
It's like they're comprimidos.
Yeah, they are.
Mm-hmm.
Comprimidos. Who's there? Yes, your classmate is now here. Lucia,
yes.
Let's do it a little bit, and then I'm gonna, let me ask the doctor if he can wait a little bit.
Okay, sure, no problem.
Hi, doctor, how are you? Dr. Roger.
Hi.
Hi, may I ask you for a favor, please? Can you give me 5 minutes with Lucia? We didn't finish working on this card.
Don't worry. Okay.
Okay, thank you so much, doctor. 5 minutes, please.
Yes.
Thank you so much.
Okay.
Okay, perfect. He's so nice. He's one of the best neuropediatricians in our country.
Oh, wow.
He's an amazing person. And he is also a teacher, so he understands that it's not easy at the beginning.
Yeah, for sure.
You can see these structures that I'm pointing. Can you watch my screen, right?
Yes, I can.
Here you see a normal bronchi. One, the right one, because the left is behind the heart. In this X-rays, you can watch this because it's too penetrated, is the term. Está muy penetrada, it has too much radiation. But normally, you are not able to watch the full vertebral column or the full ribs or the bronchi. It's not available. The heart here is not well prepared, but in this opportunity, it helps us to check the differences. Okay.
Okay.
So you can see here the normal bronchis, the shape, how it goes to each lobe. And going to the pathological one, you see enlarged bronchi. The full bronchi 3 is enlarged, is too dark, too hard. It says it's duro. That's why the X-rays are receiving or are taking that structure as if it were cartilage. This is the color of the cartilage. So this enlargement, you can see it's like a net, right? A full net. This is the COPD.
Yeah. Okay, now I get it.
Completely. Following the heart, you have the aorta, right? The aortic bottom here. Here in the normal picture, you cannot watch it completely. The shape, it's normal. The aortic arc goes to its normal place, normal position, but here you have a big structure, right? A solid one. It's because it has calcifications. That's why it turns extremely white, right? So you can see the difference is clear. It's enlarged, here is not. About the shape of the heart, well, we have to make the comparison. We have to take the size and consider the index about the cardiological. I don't remember how to say in English.
Oh, you can say in Spanish, and then I'll search for the translation later when I'm doing my homework.
Es el índice cardíaco se llama esto. The cardiological index, we said, for example, well, we have to look for the meaning.
Okay.
We have to make the size from the shape of the heart, from the apex to the biggest structure, and then make the comparison to the chart and see if the heart is enlarged too.
Okay.
Ojo de buen cubero, yeah. While practicing, this heart is in the limit, just to the point for being enlarged. You can see you have this angle well formed here. You see all the details from the liver, the stomach, right? And here you lost these details, right? The details could be a pleural effusion. So you can see all the bronchi tree is enlarged, causing maybe a pleural effusion. We need more views in X-rays, and we have to check if the heart is enlarged or not, making the comparison, the measurements. Of course, the aortic arc looks calcified. We need some more views to compare this. And the shape of the hearts. Moreover, we compare the space between ribs. It's not, of course, not similar to the normal one. It has lots of troubles for breathing. It's craziness. Poor man.
Yeah.
This poor guy maybe was a smoker, heavy smoker, and that's the consequences of this. But in a general view, it could be an idea how to describe this.
Okay, now now I have it all clear, and I think I'm going to do it right now so that I can send you and don't lose the idea.
Okay, thank you so much. Try to do it now, okay?
Okay.
So just tell me if the structure is enlarged or not, and everything you see. I'm not asking for more details.
Okay.
This is a very, very, very common situation. If you look for more X-rays about COPD, you're going to find too much X-rays, and you can compare between pathological situations. They are too similar. The characteristic is enlargement of the complete bronchi tree.
Okay. And we said that the heart and the pathological X-ray was between, in limit, right? So it was not enlarged, so that I can write it down. Okay.
Yes. Without making the measurement, I can see it's in limit. But making the measurement is the detail. By experience, it's in the limit. I'm sure on this.
And how do you make the measurement? Do you do it
there are lots
trace
of
in any lines or
Yes,
but
well, the most common method is to draw a line between the apex to the biggest point. For example, this point, you make a line. Then you make a second line from the vertebral cord to the chest, and then you just measure the two lines, make the measurement of them. It's one of the most common, the easiest one, but you have around 4 to 5 methods to do it.
Oh, all right. So I don't know how I'm going to measure it, but I think I'm just going to write down that it's in limit.
No, don't measure it. Don't measure.
Okay.
Just tell me if the cardiac shadow is clear or not. Don't worry about the rest.
Okay.
Don't make any measurement. It's not an objective of this, and it's gonna confuse to you when we get into the when you get into the med class about it. Don't worry about it.
Okay.
Yes,
Then
just tell me if the structure is enlarged or maybe has a difference in shape from normal shape, I mean, or if you see a pleural effusion, or if you see any very, very important detail. For example, the shape of the thorax is changed. In Spanish, we call this thorax en tonel. I don't know how to say that in English. Actually, I'm realizing that, yeah. But
okay, I'm going
just
to look it up. Okay.
yeah, yes, the pathological, it's a typical shape of a respiratory system chronic disease in general. For example, asthmatics have the same shape in thorax.
Ah,
Yes, don't worry about it, okay?
okay. And thank you so much. It's been so helpful. Like, I feel
Let's
like I do
practice.
have an idea right now.
Now let's practice on this. Reading X-rays actually has a specific order to do. And you can say, well, you have to say if it has too much radiation, if it's well positioned, if it checks all the anatomical details. It's not an objective to do it now. So don't worry about that details.
Okay.
Okay.
Okay. Thank you so
So
much.
no, thanks to you. And let me send a message to Dr. Roger in order to come back here.
Yeah,
No,
sorry.
he's so nice. He's an amazing doctor. If you have the opportunity to work with him at any time, try to learn as much as you can. He's an amazing sub-specialist and a very nice people. Very nice person, I'm sorry.
Oh, how nice. So yeah, I won't keep you up. So I'm going to say good night and have a nice long weekend, because I think we have a long weekend, right?
Yes, yes, we have a long weekend, yeah.
Then see you on, I don't know if we're going to see each other on Monday, but see you after the weekend.
No, don't worry. So see you Monday. Have a nice weekend. And any
Bye.
question, send me a message. That's okay.
Okay, I'll do that. Thank you so much. Bye.
See ya. Bye-bye.
Bye-bye. Good night.
Good night. Yes, Dr. Roger was way. I'm sorry, but I need to finish this with Lucia. Lucia came earlier. And that is not possible to do, but patience. Image. Flare sequence action code, leukomalacia. Just anemia. Super. Well, now I'm expecting Dr. Roger, so in that order, let's wait a little bit because he was here and, well, he as a gentleman left the workshop. Bye. Well, let's wait a little bit. A little bit. Let's wait for him. He is an amazing doctor and he's gonna understand. It's my fault. I should ask Lucia to come later. Hi, doctor. Thank you so much for your attendance, and I'm sorry for taking your time.
No, don't worry. Don't worry, teacher.
I'm sorry so much. Lucia is in the third year, well, beginning the third year of the career, and she's lost with the job.
Yes.
Yes, and I
Okay.
said, why do you do this to me? Well, but patience, we must try to help her.
Yes, yes. Yes. Yeah, she needs more time.
Yes, well, actually, she's coming late. I don't know which personal activity she had, but she asked me to come at this moment. And I said, well, anyway, come, but come
Oh.
10:30. But she came earlier. And it took more time than I expected.
Well,
Well, actually, I was reading the report, and that's, of course, it's well done. The expressions are the ones that I was expecting. Thank you. I only have two students who made the work like this. You and another doctor from Honduras. Nobody else. The rest we have to correct in detail.
oh, super.
So well done. The same with these values, about the labs in the way we talk, that's perfect. No trouble, that's the way it's expected to be reported in the clinical history. Okay?
Oh, super. Okay. Thanks, Iris.
In that order, let's start working on the letter of referral, okay?
Okay.
Let me share. Can you watch my screen?
Yes, I can. Yes.
Perfect. In the module 1, we have this example in one of the classes, right? We got this picture showing us how a doctor was making the referral of his patient. And, well, it's very clear about understanding the process to write it down. But there are some details that we are going to add in order to follow the correct format that is written in lots of countries. Here I was writing down the 7 steps for not forgetting the details about how to do it.
Okay.
And of course we have this example. In step 1, we have to remember that we have to whom is going to be referred the patient, Dr. Liz, Arana, for example, and the specialty. Neurologist, for example, from doctor, that's my case, for example, and GP, just for making it fast. We start like this. It's a letter, of course. Oh, but I'm missing a detail. Always the date. The place and date.
Date, please. Date.
Place and date. Then the to and the from. Fill the name, specialty, and location of the doctor you are expecting assistance, your information, the to and from. I was forgetting this. And now we start with these expressions. The first one, the dear doctor. In Latin America in general, that was I'm noticing while talking to classmates and while working in other countries. In Spanish, to say dear doctor is not a polite request.
No.
It's by a cultural fact, I think, it's considered a confianzuda way to talk with the doctor, and it's not correct.
Okay. Yes.
Right.
But in English,
So,
it's okay.
but in English, it's necessary to start in this kind way because you are showing confidence to the specialist that is going to receive the case, right? I mean, by your experience, if I, as a GP, tell you, dear doctor, it's not correct, we all know this, but in English, it's not the same. It's completely the opposite.
Okay.
So
Yes.
we have to take it in count, dear
But,
doctor.
okay.
And the second expression that sometimes makes us to mix the north of this, because in Latin America, we are not asking for a favor when we make a referral. We are asking for assistance, and we are extremely formal. And in some cases, that formal way of talking in English is considered rude. That's why we start with an expression like this. I would be grateful if you see this, and I would be grateful. It's not the same in Spanish. If you say that, it's not correct, but in English, it's necessary to do it in that way. So you can see it's the opposite idea, right?
Okay, yes, I catch it.
Completely the opposite. So when you follow, you got this magical phrase, because it's very common to start a letter of referral like this. Then you introduce your patient, like in the case report. As you can see, there's not a name. You don't need to add the name, because the name is in another chart when you are sending documentation, and you are sending the lab reports or extra details for supporting this information, for example. And in some countries, you have an extra chart that you fill, and you write down the name, the insurance number, the diagnosis just for information, and then you start with the referral. It's a shape of writing down. So you have your case report, right? With all of these details. Taking the first paragraph is just talking about the complaints, the symptoms of the patient, right?
Right. Yes, I can see.
So following this, in the second paragraph, you start like this. Her symptoms suggested, and then you give the diagnosis.
Okay.
The diagnosis at the beginning of the second paragraph, and then you support this diagnosis, giving a brief report about the lab, the physical exam at the beginning, then the lab tests, and finally images. Like you were working here. That's why I was asking you to make this job by steps. For catching the ideas how to make these reports, at the moment to do the letter of referral is easier, because you now have the order how to write it down.
Okay.
When you support the complaints, of course, everything in medical terminology, following the correct chronological events in a brief paragraph, the same as in the case report.
Okay.
And just tell me.
Second, this letter, how many paragraph needs to
be done?
To be done, yes.
Okay. With 2 or 3 paragraphs, enough. You don't need to round the information. You can take 1 paragraph for symptoms, for the complaints, a second paragraph for the diagnosis and the physical exam. And the third paragraph, you keep supporting with lab tests and images. It could be an order, but it's better if in the second paragraph you support the diagnosis just in 1 paragraph, organizing as brief as much as you can the ideas.
Perfect.
Just describing the most important facts. And at the end, you just give a polite farewell. For example, I hope everything is done at this point, and being grateful with your attendance, with your assistance, I say goodbye, for example, or just carefully and your signature, and that's enough.
Okay. Best regards. Okay.
That could be. That's a good way of saying goodbye, our colleague.
Yes.
And then best regards and your signature, and that's all. Or thank you for your attendance, thank you for your attention, and that's all.
Perfect. Okay, Iris. Okay.
So in that
Clear.
order, now it's your turn to write down the case reports from your patient. And they got the letter of referral.
Perfect. About my patient, no? About the images, labs. Okay.
Yes.
Perfect.
About the case you have
It's
in
okay.
order, you have all the ideas organized, it's clear how to write down. Now it's easy to make the letter of referral.
Okay. Yes, I think.
Yes.
Okay, it's perfect.
Perfect. Any question about it? I don't
No,
think so.
thanks. Thanks. Yes. No, thanks. Everything
Perfect.
is clear.
That way, in a few minutes, I'm gonna send this information about the letter of referral to your WhatsApp.
Please,
For not
yes.
missing the points. And yes,
Okay.
as soon as you can, send me back your answer. And following
Okay.
this, we're going to work on Tuesday. If
Okay,
everything
Tuesday.
is correct, now on Tuesday, I'm gonna give you a new case in order to write down everything by your own.
Okay,
I'm just giving you details. It's a moment to practice alone, so that's why this first part is not with a deadline, because it's not the same rhythm for writing for anybody.
Okay,
Lucia,
perfect.
the student that was previous to you, she's
Yes.
beginning, she's losing because she's out of the medical basis for doing this job.
Yes, I
said,
think.
well, patience.
What university is she studying?
Well, she's in Cochabamba at this point, in San Simon, I think.
San Simon.
Yes,
Okay.
but she's in second year, and I said, why second year? Why me again? Yeah, why do this to me?
Okay. Yes. She's starting.
Yes, she has the interest of this. That's the most important part.
Yes.
She wants to do it, to go ahead,
At
and
least.
I'm just
Yes,
giving
at
her
least.
some specific topics for not mixing information to her, and that's enough, I think.
Yes. She must be the youngest of this course, or not?
Actually, we have 5 students in third year that are starting the third year, and she's in second year, finishing the second year, almost at the same level. So it's not easy to work with them. We also have a veterinary, a vet.
Oh.
And I ran mad because I said, what? How can I teach you? Well, we are going to give you general information.
Yes, you have to teach the medicine also.
Yes.
Not
English.
English.
What's happening? Yeah, in the previous group, I had a university professor out of mind with this. She dropped the course because she lost the focus on this. She told me that was not the way she was expecting. And I told her, anyway, that's the program. It's not my failure.
Yes. What is he expecting from this course?
She was expecting just vocabulary, memorizing vocabulary, no more.
Oh no.
And I told her, of course not. The program is not done in this way. And I'm sorry, you are not a doctor. I don't know how I can teach you.
Yes, he needs a dictionary, a medical dictionary, and that's enough for him.
Yes.
Yes. Well, don't worry.
Okay. Well,
okay, Iris.
So thanks for your attendance. Thanks for being here.
Thanks to you.
And I'm sorry again for changing at the last time 2 minutes.
No, it's okay. Don't worry.
Thank you so much. So
have a nice weekend. Have a nice carnavales.
I know. I hate carnival. I don't like it. I don't know.
Okay.
You know, like I love to stay at home, and watch my TV, something different, and that's enough.
Enjoy holidays then.
Yes, I need to rest.
At least.
Yes. No, have a nice carnival too, and see you Monday, Doc.
See you, Iris. Bye.
See you. Bye bye.
Good night. Bye.
Good night. Well, at this point, we finished everything. I'm out of camera. My camera is failing too much, even for my cell phone. So everything is done. Everybody came. So